So up first, we have Abby Changer with Health Careers. That's just doctors and nurses, right? Abby is the Careers Information and Quality Lead for the NHS Health Careers team. Today, she will be talking about the wide range of healthcare roles on offer in the NHS. All right, I'll leave it to you. Thank you.
Thank you very much, Daisy, and good morning, everybody, and apologies that we're a few minutes late kicking off. So yes, as Daisy said, my name's Abby, and I'm the Careers Information and Quality Lead for the NHS Health Careers team. I'm a nurse by background and have worked in the NHS for nearly 25 years now, doing various roles. And really, in the next 45 minutes or so, hope to be able to get across to you some of the amazing opportunities within the NHS and some of the different routes in, because I think some people have got, partly because of the media, quite a narrow view of the range of roles within the NHS, hence the title of this talk, really, that it's definitely not just doctors and nurses. And hopefully this talk will set you up really well for the rest of the day, in that it will give you an overview, and then you can go off and find out more about specifics of some of the different roles that you might be interested in. And really, I'm really happy that you are here today, whether you have already made your mind up about the career that you are aiming for, or whether you are still a bit unsure about whether you want to work in health at all, or you know you want to work in health, but you're not quite sure what role you want to work in. So I hope that, over the next half hour or so, that you will get a few ideas, and I'll give you some resources as well so that you can go away and find out more information about the different roles and the routes in. Hopefully we'll bust some of the myths as well. So you might be here thinking, well, I want to work in health, but I don't actually want to have a patient-facing role. I don't want to deliver hands-on patient care, but I want to be involved in some way. And that's fine too. There are behind-the-scenes jobs. There are roles where you will be working very much behind a screen or at the end of a phone, just as much as there are the roles where you're providing that hands-on patient care. And the important thing to remember is that with all these roles, whether you are there on the front line, as it were, hands-on patient care, or you're more behind the scenes or in a laboratory, for example, you are still making a difference to people's lives. And that's a really important thing to hang on to. Okay, then, so just to sort of talk you through what I'll be talking about, so giving you a little bit of background and context, showing you some of the careers that are available and some of the routes in. And then I'll show you some resources from the NHS Health Careers team, and NHS Jobs, which is a really useful resource, actually, whatever stage you're at. And also then tell you how to find out more. Please do put your questions into the chat box, because hopefully we'll have plenty of time at the end to address those. But the email address and the phone number that you can see at the bottom of my slide there are for the NHS Health Careers Contact Centre. So if you go away after today and you think, oh, I really wish I'd asked about that, don't worry, you can still get in touch with the NHS Health Careers Contact Centre via those methods. So please do bear that in mind. Okay, so a little bit of background. The NHS is a huge beast, and it delivers its healthcare through over 1,000 different organisations. And the reason I tell you that is because each one of those organisations is an employer in its own right. And each one of those, therefore, will be making its own decisions about how many apprenticeship opportunities there are, which vacancies they're advertising, some of the progression opportunities available, and things like work experience opportunities as well. They will vary from organisation to organisation. So you might live down the road, 4 miles down the road from one NHS trust, which, for example, is advertising lots of degree level nursing apprenticeships. But there might be another NHS trust down the road the other way that isn't yet doing that. So it does really vary, and that's just important for you to know, so that you can manage expectations. Okay, for those of you that like a good fact and figure, the NHS is the 5th largest employer in the world, the largest employer in Europe. And if you take into account the NHS in England, Scotland, Wales and Northern Ireland, there are approximately 1.7 million people working for the NHS. So if you join the NHS, you are joining a very big family. And as someone who's worked in the NHS for all my adult life, I have a huge sense of pride in working for that organisation. And I think particularly at the moment with what we're going through with COVID, the NHS is very much at the forefront of people's minds, and they're very much more aware of some of the roles within the NHS as well, which is great. And I think it, you know, is seen as a bit of a national treasure. So the media and what it portrays the NHS as is not always helpful. There are some great documentaries now. Some of you might have been watching the ambulance documentary, which is, you know, is really showing the service for what it is, which is great. But some of the other perhaps slightly more light-hearted programmes do have a little bit of a narrow view of roles in the NHS. So don't necessarily, you know, think that everything you're seeing on the television is a true representation. Okay, so what careers are available in the NHS then? Now, obviously, we haven't got time in this session to go through all 350 different roles that there are, but I'm just going to talk you through some of the main groupings of those roles, just to start to give you a little bit of a flavour, as I say, particularly for those of you who perhaps aren't quite sure which direction you're heading in yet. So we've got the allied health professions, which there are a lot of sessions on during the event today. So if you're interested in the allied health professions, I know there'll be a lot of opportunity to find out about this amazing range of roles. So there are 14 different roles in the allied health professions, and it includes roles such as drama therapist, operating department practitioner, speech and language therapist, podiatrist, radiographer, occupational therapist, physio, etc. There are them. I haven't listed them all, but there are many in that group. All really exciting roles, focusing on the whole and in terms of helping patients absolutely live their best life they possibly can. And as I say, there'll be loads of opportunities for you to find out more about the allied health professions, or AHPs as we tend to refer to them as, throughout today. Then we've got the ambulance service team. Really important to remember that it's not just about the paramedics. There are emergency care assistants. There are the people working in the call centres as well, so the call handlers, the medical dispatchers who are sending off the ambulances. So think very broadly within these groupings, because it's never just about sort of one role, or very rarely. Then the dental team, same again. This isn't just the dentists. You've got your dental nurses, dental hygienists, therapists, technicians, etc. Many different roles within that team, and lots of opportunities for progression. Then we've got doctors, and again, I know there are a lot of sessions on getting into medicine today. So for those of you interested in that, I know you'll be able to attend some fantastic sessions today. 60+ specialties within medicine, and you know it's a lengthy training route. But if you're committed and that's the career for you, then a very fulfilling career ahead. Health informatics, this is a really growing area for health. This is the use of data to really help improve quality of patient care. So for those of you with a real interest in informatics, technology, stats, that sort of thing, then loads of really interesting opportunities in that group of staff. Healthcare science, again, I think partly because of COVID, there has been a bit more focus on some of the amazing healthcare scientists in the NHS. Again, lots of different specialties within healthcare science. And some healthcare science roles are actually very patient-facing and very much involved in the diagnosis and the treatment of patients, whereas others of the healthcare science roles are much more laboratory-based and not so much patient-facing. So again, something for everybody, whether you're the sort of person that really wants that patient contact or not. And then management. So we do need managers. We need managers to help these huge organisations to run smoothly. We need HR managers, finance, operational managers, and people who look after the estates and facilities of, you know, what are very large buildings in some cases. So lots of opportunities there. The medical associate profession. So this is a small group of staff, relatively speaking, includes roles such as physician associates. And again, I believe there is a session available on the programme about physician associates today, a really emerging role here where you're trained along the medical model and working very much within the medical teams in all sorts of settings, including GP practices, seeing your own lists of patients, or in secondary care, so in, for example, hospitals, working in particular specialties. Couple of routes to physician associates, just to mention very quickly. So on the whole, it's still a postgraduate training route, but there are now 2 universities offering an undergraduate 4-year master's programme to become a physician associate. So really good alternative, perhaps for those of you wanting to do medicine, either not quite sure about that, have a look at physician associate. Okay, then we've got midwifery. Excuse me a sec. So obviously, midwives are the main role within this team. And it's important to remember here that their role is very much about looking after the mother during the whole of pregnancy and labour and immediately afterwards. Pharmacy then, and again, oh sorry, I've missed out nursing. So nursing, very, very large staffing group here. 4 different fields of nursing, so adult, mental health, learning disability and children's nursing, all of which offer amazing progression opportunities, and also a really varied range of entry routes in now. And I'll talk through briefly some of those entry routes shortly, because you'll be surprised probably at the range of ways to get into some of these careers. The pharmacy team then, so again, not just pharmacists, but pharmacy assistants, pharmacy technicians as well. And again, with a lot of these groups that I'm talking about, there are apprenticeship routes available as well. The psychological professions are a really growing area of healthcare here, partly really because of the challenges in terms of mental health that we're facing in our society at the moment. And again, referring back to COVID, you know, we are sadly seeing an increase in incidents of these sorts of challenges, and therefore the psychological professions team is really expanding, both in terms of types of roles, but also in terms of numbers of posts as well. So lots of opportunities there. Public health, again, because of COVID, very much more in the public's eye. So those roles, if you're interested in how you can really have impact on our society and communities in terms of helping people to live healthier lives, helping to prevent these sorts of and manage pandemics as we find ourselves in at the moment. So again, lots of different roles within that group. And then last but certainly not least, the wider healthcare team. And this is a bit of a catch-all term really for many, many different absolutely vital roles, every single one a cog in this huge machine that at the end of the day is delivering care for patients. So the wider healthcare team incorporates, you know, people who are involved in maintenance, you know, you've got electricians, mechanics, etc., porters, drivers, healthcare support workers, providing a really important part of hands-on patient care, working within nursing teams, within the allied health profession teams, within midwifery, etc. So many, many different roles in there, and unfortunately not time to go through every single one of them, but just hopefully giving you a bit of an overall flavour of what's available. Okay, so some of you might be joining and you've already got your degree, or you're working towards your degree already, or you absolutely know that you're heading for university, and that's great. Some of you might have joined this thinking, well, I don't know whether I want to go to university, or I'm not sure I've got the grades to go to university. Really important message here. You don't have to have a degree to work in for, but there are plenty of opportunities where you don't need a degree. And there are also lots of ways that can move you more kind of gently and slowly up towards degree level professions, particularly, as I said, through apprenticeship routes where you can really gain experience as you are studying and take a bit more time to get to where you want to get to. Okay, so let's just run through some of the different entry points that are available then within the NHS. So we've got entry-level roles. So for people who don't have many qualifications, perhaps just a few GCSEs, then there are entry-level roles that you can get straight into. So for example, some healthcare support worker roles, maintenance roles, potentially some administration roles, again, a whole range that is still accessible to you if you hold the right values, and we will come on to that shortly because that's really, really important. Perhaps you're looking for an apprenticeship or training opportunity. I know there is a session later on today from Lucy Hunt about apprenticeships in the NHS. Do tune in if you're interested. There are a massive number of apprenticeships available now in the NHS, and these range from GCSE equivalent apprenticeships right up to master's level apprenticeships, and again across a variety of types of roles from IT, finance, pharmacy, through to degree level apprenticeships such as radiography, nursing, midwifery now, and many of the other AHPs, and healthcare science as well. So really think carefully about how you want to get to where you want to go to, because there are so many options now. And if going to university in the more traditional sense isn't for you, think about degree level apprenticeships where you're going to be earning a salary while you're learning on the job and really gaining that very valuable experience. Apprenticeships you look for on NHS Jobs and also the government Find an Apprenticeship website. They are advertised in the same way that a job vacancy is, so do keep an eye. Okay, maybe you're at FE College doing a course such as BTEC in Health and Social Care, or NVQ in Healthcare Science, for example. Again, these can be really good entry routes into roles in the NHS. And if you are doing a course like that, you're probably on placement somewhere. Use your placement, use it to its maximum to try and find out what vacancies might be available in that organisation, what might be coming up. Okay, maybe you're wanting to do a DIP-HE, so some other sort of higher education course. Again, different routes in through that. Or perhaps you know, after a full bachelor's degree, and this is where many of the different healthcare roles come in, because, for example, to be one of the AHPs that I mentioned, to become a nurse, midwife, doctor, you do need to have a degree, whether that's by going to university in the traditional sense or by doing a degree level apprenticeship, which is available for many of those roles now. Or postgraduate training. So there are some roles within health that you do require postgraduate training for. These include becoming, for example, a clinical scientist, and also psychologists, such as clinical psychologists. That is a postgraduate training route. So if you really enjoy study and you are looking to do one of those roles, then you have got a great training kind of program set out ahead of you potentially. Or some people come in from the NHS having gained experience in other areas. So for example, maybe in the armed forces or in industry or in some other sector. And again, those experiences that people bring are really valuable and enrich the NHS workforce, because if someone's values match, and again, as I say, we'll talk about that shortly, then it doesn't matter whether they've worked in the NHS before for many roles, because we really value experience that come from other areas. Okay, now this slide shows just a small selection of some of the apprenticeships that have been advertised in the NHS over the last 3 months. So this is just to give you a little bit of an idea of what is out there, what's available. And you can see how varied it is, from information management and technology, through to pharmacy, cardiac physiology, so that's a degree level apprenticeship in healthcare science, operating department practitioner, another degree level apprenticeship there, so a level 6 apprenticeship, a registered nurse apprenticeship, associate ambulance practitioner, apprentice in finance, many different apprenticeship opportunities. So get onto NHS Jobs, have a look and see what's out there. There might be something that you just had never even considered the NHS would offer before. Okay, so in terms of degree level apprenticeships, really exciting things happening here, and we're starting to see more vacancies coming on board. So you can see there the various degree level apprenticeships that are already approved for delivery in the NHS. Just a little word of warning here. Just because an apprenticeship standard has been approved for delivery doesn't mean that we are seeing many vacancies or any vacancies yet. And it comes back to my point at the beginning about the different organisations within the NHS. So for example, take midwifery. Just about a week ago, I saw the first NHS advert for midwifery apprenticeships that was open to external applicants. So this is really exciting, and we do expect to see more of the midwifery apprenticeship opportunities becoming available. Registered nursing degree level apprenticeships are starting to pick up, so regularly seeing vacancies being advertised now, so that's really, really good news. And you can see, as I say, healthcare science vacancies are advertised every now and again, operating department practitioner, occupational therapist, and many others. So a really, really exciting route to get to where you want to go. Okay, I said that I would talk about some of the different routes there are into nursing. Now, I've picked nursing just because it is one of the ones that is possibly a little bit further ahead in terms of some of the different routes in, but I could have picked a number of other roles as well. So this is just to give you some examples of the flexibility of training routes in. Excuse me. And what's important to note is that you'll see along the top there, registration with the Nursing and Midwifery Council. In order to work as a nurse in this country, you have to be registered with the Nursing and Midwifery Council. They are the regulatory body of nurses. So any sort of training that leads to becoming a registered nurse has to be approved by the Nursing and Midwifery Council. Each one of these 4 routes that I've set out here will result in the same endpoint, will result as someone being a fully qualified registered nurse with the Nursing and Midwifery Council and able to work as a registered nurse in this country, okay? So we've got Sanjit to begin with, 5 GCSEs at 4 to 9, including maths and English. Has a part-time job working with students who have learning disabilities, really, really enjoys it, and actually decides that he'd like to end up as a learning disability nurse. So his local NHS trust is advertising opportunities to become an apprentice nursing associate, which is a 2-year level 5 apprenticeship. And Sanjit is successful in getting a place on this and completes that 2-year nursing associate apprenticeship. And then luckily the trust he works in also offers a 2-year top-up apprenticeship at level 6, degree level, in order to become a registered nurse. So that would be a 4-year route there for Sanjit, and he ends up as a registered learning disability nurse. Okay, then we've got Helen. This is probably what you'd think of as the traditional sort of route. So 3 A levels, wants to be a children's nurse. After A levels, applies to university through UCAS and gets a place on a children's nursing degree. 3 years later, having successfully completed that course, Helen's a fully qualified professional children's nurse. Then we've got Kamara. Kamara has done a degree in psychology to begin with, but is really interested in mental health nursing. Because of her first degree in psychology, she's able to access an accelerated program in mental health nursing, and that takes her 2 years, and at the end of that she is then a registered mental health nurse. And then finally on this little list of examples, Chantel with GCSEs in Maths and English gets a job as a healthcare assistant and really enjoys that, and is able then to access a senior healthcare support worker apprenticeship at level 3, so that's equivalent to A levels, and then is able to access the 4-year nursing degree level apprenticeship and become a registered adult nurse. So just a few of the ways there that you can get to where you want to go, and I hope that demonstrates some of the different routes. And it's down to personal preference, it's down to your circumstances. You can take a wiggly route, you can take a very direct route. What matters is that you are progressing, you're learning, you're enjoying what you're doing, and you're getting to where you want to go. Okay, so just some examples then of some of the different interests that you might have and some of the roles that might match those. So if you're a very practical person, you enjoy using practical skills to solve problems, to make things better, these are just some of the roles that you could consider and look at. And this is not an exhaustive list, it's just some examples. So clinical scientist in respiratory and sleep sciences, for example. Gardener, who knew gardeners do work in the NHS? Dental technologist, drama therapist, so someone who uses drama as a way of helping people with maybe mental health challenges to express how they feel, rather than having to use words potentially which might be very difficult for them. Carpenter, occupational therapist, motor vehicle technician. So I won't read them all out, but just some of the ways that you can use your skills and interests in roles in the NHS. Maybe you want to work with children, so it's not just about becoming a children's nurse or a paediatrician. There are lots of other ways that you could do this. So for example, again, being an occupational therapist, but specialising with working with children, being a mental health nurse, maternity support worker, a newborn hearing screener, or a health play specialist. So someone who's employed to help distract children, but also help them understand what's happening to them through play. And then finally, science. I'm sure many of you on this webinar today are interested in science. There are so many ways, endless ways to use an interest in science in the NHS. So, you know, whether it's as a psychiatrist, an orthoptist, radiography assistant, dietitian, dentist, healthcare assistant, many, many different ways to use that knowledge and interest in science to make a difference to people's lives at the end of the day. Values. Okay, so this is super important. So listen really carefully. Your academic qualifications obviously need to match the entry requirements for different courses and jobs, but it is no good having the right qualifications if you don't hold the right values and behaviours for the NHS. Because if you're unable to hold compassionate and empathetic conversations with people, if you're unable to demonstrate respect and dignity to people, then working in the NHS isn't going to be right. Okay, so these 6 values are set out in the NHS Constitution, and when you go for an interview or apply for a course, a job, you may well be asked to give examples of how you demonstrate these values in your everyday life, in your work, if you've got a Saturday job or work experience or volunteering, in your school life, in your college life, in your university life. Think very broadly, okay? So you could get asked, okay, tell me about a time when you've demonstrated compassion. What does respect and dignity mean to you? Okay, so these 6 values are so important. Don't think of them as less important as your qualifications, because they aren't. Okay, so working together for patients, respect and dignity, commitment to quality of care, compassion, improving lives, and everyone counts. Those are so important. So really make a note of those, go away, find out more information about them, and think about how you would evidence them. Start to build a bit of a bank of examples that you can use. Okay, now work experience. This can be a very hot topic. Everybody wants work experience. It's always been a little bit difficult to get, and obviously at the moment it is even harder to get. But don't worry too much, because employers and admission tutors at universities, they know the current situation. They know that it's going to be more difficult to get work experience at the moment. There is an increasing number of virtual work experience opportunities coming online, so search for those. I think some of the sessions today are focused on work experience as well. So if that's a thing you're particularly interested in, seek those sessions out and have a listen into those. But again, think very broadly. Even if you've got a Saturday job in a shop, you're demonstrating customer service and you know, potentially some of those values from the NHS Constitution. So really try, I know it's a cliche, but try and think out of the box about some of these things, okay? And if you do manage to get a work experience opportunity, draw as much out of it as you can. Reflect on what you've learned from it. Don't just, you know, go along for a couple of days or whatever, or attend an online session and just think, well, that was interesting, that was nice. Make some notes, reflect on what you've learned. Think about what you saw, you know, particularly if you're lucky enough to get into a clinical setting. Think about how you saw those healthcare professionals behaving around the patients. Look for where they are demonstrating those values that come from the NHS Constitution. Draw as much out of it as you possibly can. Okay, so on to sort of some of the resources that are available now. Some of you may have seen the Health Careers website already, healthcareers.nhs.uk. So this is the NHS Careers website. Lots and lots of information on there. I'm just going to talk you through some of the main features and some of the main resources that you can find on there. But I'd really urge you, if you haven't already had a look at it, go away and have a look after today and really dig around for bits of information. So you can see along the top there, the main tabs. And the ones I'm going to highlight are the careers quiz, explore roles, and the under career planning. We've got our course finder. You can register for an account with the NHS Health Careers website, and this will mean that you receive targeted emails every now and again that match the interests that you've expressed when you register with us. You can use the search function, and if you are registered and logged in, the information on the homepage will be tailored to your interests as well. Okay, then down at the bottom of the page, you can see in the bottom middle there a link to the NHS Constitution page. So those values that I was talking about just now, click on that and that's where you'll find out more about those. If we've got any teachers or careers advisors watching, there are resources for you on the website as well. And then sort of latest news and videos, a range of videos. A lot of them are people talking about what a day in the life of, you know, radiographer, for example, or podiatrist might be. These are a really great way to find out more, hearing from people who are actually doing the roles. Okay, so the Explore Roles page on the website has got role pages on about 250 of the roles in the NHS, and sets out information such as entry requirements, training, what working life is like, progression opportunities as well, and pay. So have a look. You can also compare 3 roles side by side if you want to. So if you're not quite sure what you're interested in, click on the compare roles feature and you can compare up to 3 roles and see the sort of equivalent information, and it might just help you narrow things down a little bit. Okay, so the Find Your Health Career tool is really helpful. This is a very, very popular tool on our website. It's in 2 stages. So if you haven't got if you're not logged into our website, you can do the first 50 or so questions without any problems at all. So it's a series of statements, and depending on how you respond to those statements, it will then bring up some suggested roles that match your specific skills and interests. And then you can click into those and find out more. If you do have an account with us and log in, that then opens up a second set of questions, which will help narrow it down and bring up an even more specific result for you. So I would recommend, even if you're fairly sure about which way you're heading in a healthcare career, perhaps have a go at the quiz anyway, see what it brings up, because it might bring up some really interesting alternatives for you, or some things that you hadn't considered before. So have a go at that. It doesn't take very long, and you could just, sit at home and do it whenever you've got a free few minutes. The Course Finder tool. So this is, again, a really popular tool on our website. You'll find it under the Career Planning tab. And our Course Finder tool lists courses that lead to professional registration in many of the healthcare professions that we've been talking about. So if you're looking for a course in medicine, dentistry, physiotherapy, nursing, midwifery, dental hygiene, lots of different roles, you can find the universities that run these courses on here. And then when you've done your search, you can click on the link that takes you to the university webpage, and that's where you'll find their entry requirements, etc. It's really important you know that. Some of you will already have discovered that entry requirements can really vary from university to university. So, for example, to become a speech and language therapist, there is no set list of entry requirements, or there's no set kind of, right, these are the exact A levels that you need, because every university will have something slightly different. So it's really important, get on those university websites, see what they're asking for. Okay, and the Course Finder can be a really helpful way of bringing up all those results in one place for you. Okay, if you're interested in some of our literature, we've got a series of inspirational postcards. So again, particularly if we've got any careers advisors or teachers on this session, you can order these free of charge. We've also got I've got one here, little A6 booklet, which goes through a few of the careers in health. And again, these can be ordered free of charge. Sorry about that. You can also download them from the website as well. Okay, step into the NHS website. Those of you who are perhaps more in your early teens, if you're watching this, this can be a really good website for you. Gives information on about 60 plus of the roles listed, so it's a little bit less overwhelming perhaps than the main website, where there are so many roles to look into. Good information about work experience placements as well on here, and there's also all the information about the schools competitions that we run. Right, the NHS Jobs website. This is such a useful resource. Firstly, if you're looking for a job or an apprenticeship, this is the place to go. as well as the government find an apprenticeship website. But the other way that it's really useful is if you're interested in a particular role and you're not quite sure what you need to do to get there, do a search on the NHS Jobs website. It'll bring up vacancies that match whatever key search words you've put in. And then when you've clicked into an advert, go to the person specification, because that's where the employer sets out the qualifications that you need and the experience that you may need, as well as other things such as skills and that sort of thing. So it's a really good way of finding out what the employers are wanting, because at the end of the day, all of you are here because you want a job. You know, we all want to get jobs at the end of the day, and employers are the people who give us the jobs, and we need to meet what the employers are asking for. So use it as a really useful resource. If you register with NHS Jobs, you can then set up email alerts, and you then can be emailed when a vacancy is advertised that matches the search criteria you've put in. So if, for example, you want to become an operating department practitioner and you want to do it via an apprenticeship route, you can put that as a search in there, and then as soon as one is advertised, you will get an email telling you that it's been advertised. So it's a really, really helpful website. This is also on the NHS Jobs website under Browse Jobs. It's a great way of finding out contact details of your local NHS organisations. So if, for example, you're trying to get in touch with them to find out whether maybe they are going to be advertising some apprenticeship opportunities soon, or what work experience opportunities have they got, that sort of thing, then this is a really useful website for finding contact details. Okay, I'm just going to briefly touch on financial support for healthcare students. So the good news is that from September this year, some financial support was reintroduced, because unfortunately in 2017 the full bursary for many healthcare courses was removed by the government, but they have now brought back some help towards living costs. So it doesn't pay your tuition fees, but it does help you with living costs. So if you're studying, if you're an eligible student, and that relates mainly to things like residency, if you're eligible studying nursing, midwifery and many of the allied health professions, then you will be able to get at least £5,000 a year in a training grant. Doesn't have to be repaid. Okay, so you will need your student finance as well to help with tuition fees, etc. But in terms of living costs, you're going to get at least £5,000 a year. Now, if you are studying, if you're starting to study mental health nursing, learning disability nursing, radiography, podiatry, prosthetics and orthoptics, I think I listed them all there, you will also qualify for another £1,000 a year. And certain areas of the country as well are going to be, students there will be getting another £1,000 a year. We're still waiting to hear from the government what those regions are. There is also help towards travel and accommodation costs if you're having to travel for your clinical placements. And all of this funding comes from what's called the NHS Learning Support Fund. Okay, so the NHS Business Services Authority administers this, and they've got lots of information on their website, and you apply for it through there as well. So if you are looking to go to university next year, for example, then have a look at the support that you'd be eligible to receive, because there might be more there than you're expecting. Okay, so that's really good news. So I hope that's been helpful. As I said at the start, we couldn't possibly cover every single different role in health, but I hope it's given you a little bit of a flavour of what's available and some resources so that you can go away and find out more. I hope I've just dropped some seeds of thought into your head so that you can be inspired a bit to your next step. Please do ask questions. Please do have a look at our websites as well. And as I said, if after today you suddenly think of questions you wish you'd asked, then please don't hesitate, just get in touch with our contact centre. So thank you very much for listening, and we're going to have a look now and see what questions there might be. Okay. Right, let me see if I can find these questions. So let me just go back to the top. Bear with me a sec. A few people having a few technical issues by the looks of it at the start. Let me just find, hopefully you will manage to get in the end. Sorry, I'm just trying to find to see if there are any questions. Some examples of how you can demonstrate the NHS values. Georgina, thank you for your question. So hopefully I said some of them. So it would be giving examples from, as I said, from any area of your life as to how you reacted in certain situations maybe, or things that you saw happening that made you think that didn't feel quite right. And you know, and even if it's a situation that you were in and you felt you didn't react in a way that demonstrated NHS values at that point, but you can reflect on it and talk about what you would do differently. Some of the other things that sometimes happen in interviews is that some candidates might be asked to look at a patient complaint letter, for example, and talk about how they would respond to that patient complaint. Or you might be asked to watch a video showing a particular scenario, and again, perhaps in a group or as an individual, discuss what happened in that scenario and perhaps how members of staff should have reacted, or how they did demonstrate the values by how they reacted. So it really is, as I say, just think as broadly as you can about these things, and there are many little ways that you can demonstrate the values. It doesn't all have to be going and volunteering for 10 hours every week. It's, you know, but of course things like that are brilliant, but it's about you recognizing the values and being able to translate your experiences to demonstrate that you've got them. I hope that helps. Okay, let me see if there is anything else. Phoebe, thank you, taking lots of notes. And I think this is available to re-watch as well. Paramedic apprenticeships common? Okay, that's a really good question, Evie. No, they're not at the moment, but we do expect to see them becoming more frequent. But at the minute, the way that people are accessing them on the whole is by joining an ambulance service trust at a more junior role, and then you are in position and able to access paramedic apprenticeship degree level opportunities when they come up in your organisation. So that's the best thing to do at the minute. If you're really keen on a paramedic apprenticeship, get in at an entry level role. There might be an apprenticeship opportunity at that sort of level as well, emergency care assistant, for example, and then you are there in the organisation when those degree level opportunities come up. So that's the best thing to do in that. So find out who your local ambulance trust is and get in touch with them and see what sort of opportunities they've got. Okay, right. Anyone else talking about psychological jobs? I'm not sure, to be honest. Hopefully one of the people running the event will be able to tell you or have a look on the programme and see what else there is today. Shaheen, thank you for the thank you. That's much appreciated. Zoe, what would you need to take a degree in if I wanted to get into healthcare science? Okay, really good question. First of all, I'd really recommend you go to our website and underneath Explore Roles, click on the healthcare science bit, and that will tell you loads more about the entry and training and routes in. It really depends what you want to end up doing. There are healthcare science apprenticeships that incorporate what's called the practitioner training program in them. So you get about 50 weeks of experience in your degree as well. So they can be a really good way of speeding up your process within healthcare science. So I'd really recommend you have a look at some of those. Look on our course finder as well and look at the options available in healthcare science. But as I say, it depends what bit of healthcare science you want to go into. Okay, what would be the most ideal volunteering work experience the healthcare jobs look for? So I think, as I sort of stressed at the minute, it can be so difficult to get clinical work experience within a healthcare setting, but look for care homes, look for charities. As I said, anything you can that helps you demonstrate those values. So even, as I said, working in a shop would enable you, to demonstrate some of those values. So yeah, think broadly. Okay, Sharia, are there apprenticeships in dental hygiene? Oh, now I can't remember off the top of my head, actually, Sharia. There definitely are in dental nursing. But what I would do, have a look on NHS jobs and see what you can see there. I'm pretty sure, actually, I can quickly have a quick look up for you and see. So there is an oral health practitioner, clinical dental technician. Yeah, so there are things happening in the dental world in terms of apprenticeships. So yeah, have a little bit more of a look on the website, and also look on NHS Jobs. Darren, best ways to get work experience. Hopefully I've covered that. As I said, don't panic too much at the minute, because employers and universities do know the difficulties in getting work experience. Where's the post-event feedback form? I'm not sure. Hopefully one of the event organisers can do that. How can we volunteer or get a work experience with COVID-19? Yeah, really tricky. Again, hopefully I've covered that. And Reem, your question about work experience for doctor, again, there are some online opportunities, particularly around medicine. So there's something called Observe GP. So if you Google Observe GP, you'll find a virtual work experience. And Brighton Med School, I think it is, has also had a virtual work experience opportunity. As I said, get on Google and see what you can find in terms of virtual stuff. Yeah, so lots and lots of questions about work experience, which doesn't surprise me. It is so difficult. Okay, sports exercise medicine. Do I need to do full study of medicine? Okay, so Leah, thank you for the question. It really depends what you want to do within sports exercise medicine, because there are obviously other routes in. So, for example, even podiatry, some podiatrists end up working with elite athletes because the podiatrists are all about lower limb health. Physiotherapists, for example, can, some psychology roles as well involved in sports exercise medicine. So it depends what exactly you want to end up doing there. Okay, right. What would you have to do to become a midwife? Thank you, Marley. So depends how you want to get there. So you do need a degree level qualification to be a midwife, but there are now a couple of ways to do that. So you can either go to university, and it's usually a 3-year course at university. Have a look at the university websites to see what the entry requirements are. But there is now the degree level midwifery apprenticeship. Now, as I said, I've only just seen the first advert for those, but they will start to come. And another way to get in is to access, for example, a maternity support worker role in an NHS trust. And then again, much as with the paramedic, you're in place there then in an organisation. And when the midwifery degree level apprenticeships become available, you'll be there to access them, and you'll have built up valuable experience all the time. So it's never going to be wasted time. Okay, how can research different health careers, decide on what we want to do at university? So Darren, thank you for that question. I would recommend you do our find a career quiz. So get on the Health Career website and do the Career Finder tool, because that will help you narrow down some ideas, and then have a look through the Explore Roles section and see what you can find. Okay, is chemistry A-level needed for most NHS jobs? It really depends what you want to do. So usually to get into med school, you need chemistry A-level. And I say usually because there are some exceptions. For many healthcare science roles, you might need chemistry A-level, but not all. So it really varies. So again, have a look, research the role you want to get into, and then look at the different ways that you can get there. Oh, thank you. Someone's pointed out that there's a talk at 4:50 about becoming a psychological wellbeing practitioner, for those of you that want to do that. Can I get into medicine if I choose English, literature, biology and chemistry? Reem, thank you. I would say that's probably okay, but again, check the university websites, check their entry requirements, but chemistry is the really key one for medicine. Okay, clinical therapy, what sort of work? It was another work. I'm sorry, I can't give anything more specific really on work experience. Just knock on as many doors as you can, I think would be my advice there. Therapeutic radiography, do I need biology at A-level? Again, get on those university websites, Michael, and have a look and see what they're asking for. Sorry, because the questions keep moving, so I hope I'm not missing any out. I'm not answering all the work experience ones, because hopefully I've covered that. where have I got to? Bear with me, sorry everybody. Exact route to get into dentistry. So Shav, get onto our website, go to Explore Roles, click on dentistry, and you can find out more about the training pathway for becoming a dentist there. Danit, so you've asked about being a social worker. So there's a really good website I can recommend, and actually I can put it in the chat for you. It's called Social Work England, and they are the regulators of social workers in this country. So have a look and you can find out more there. Can I post the website link there? Is that for the Health Careers website? Is someone asking? I can certainly do that. And you can see, there it is. So if you click onto that, you will see the many different parts of the Health Careers website that there are. In fact, what I could do very quickly, we've got 5 minutes, is to show you the website. Let me see if I can. I am going to share. Right, hopefully you can all see the Health Careers website now. I hope. I can't see the chat at the minute, so I'm just very quick. I'm going to assume it's working, and I'm going to quickly show you some of the parts of the website. So the Career Finder quiz is here, undertake our career quiz, and you just click get started and start your way through there. Explore Roles is where you'll find the different groupings that we've been talking about. So for example, under allied health professions, we can have a look in orthoptist, and you'll see there's often a video available. You can find out more about entry requirements, working life, skills, training, career development, and then some live vacancies that are on offer as well through NHS Jobs. So that's the Explore Roles section. And then under career planning, this is where you'll find the course finder tool. So let's stick with orthoptics. If, for example, you're looking for a degree in orthoptics, an undergraduate degree, click search, and that brings up the degrees available in orthoptics. And then if you want to click in to find out from that university what their entry requirements are. Then
Abby, I'm sorry, but we can't see the website.
Oh no! Oh dear, you can see my, right, okay. I will quit that idea then. Thank you. Sorry about that, everybody. Thank you for letting me know. Okay, anyway, have a look at the Health Careers website. You've got the link there now, and just explore the different tabs available to you. Okay, so we've pretty much finished the session. I'll just see if there are any last minute questions. Yeah, I think, to be honest, so pharmaceutical scientists, again, have a look on the website and see what you're finding. Required GCSE grades, again, get onto the university website, see what their entry requirements are. Okay, well, thank you all very, very much for listening. I really hope it's been helpful. Use the resources that I've pointed out for you, and really enjoy the rest of the day as well. It's an absolutely amazing lineup with lots of amazing opportunities. So make the most of them, and use them for your applications and things in the future. And all the very best to all of you.